approximately 20% of our population is in the sandwich generation. That means you're caring for your own family and you're caring for an older adult loved one, and you're working. You're trying to make a living and you're trying to be meaningful and purposeful in this life. You can't do it by yourself, nor do we expect you to. But that's the thing, Tiffany. Family caregivers need and want to be heard, seen, and supported. Sometimes people just don't know that supports are there, so I make it my business to ensure that supports are presented in a way that's palatable, that's relatable, that's understandable, and that's accessible.
My name is Tiffany Whitlow, and this is Now Included Unfiltered. Welcome back. This is Now Included Unfiltered, and I am so excited to welcome Dr. Macie Smith here to our podcast today. Welcome.
Thank you for having me, Tiffany.
So, before we get started, go ahead and break it down. Do you have a doctorate, a doctoral? You have, you tell us what you got.
Well, thank you for leading with that question, because I think sometimes people are like, well, what is it that you do? Because I have an earned doctorate in higher education leadership, and because I talk about Alzheimer's and dementia and caregiving, that's my specialty area, sometimes people think I'm a medical doctor, and I am not. I have had, Tiffany, people come up to me after the end of a seminar, and they would say, hey, doc, can you look at this prescription? I say, well, that's about all I can do is look at it. Like, I'm not that type of doctor. Now, I can connect you with somebody, but I am a licensed social worker, and I am a gerontologist. I work specifically with seniors and their families who may be living with Alzheimer's, dementia, cognitive impairment, or really just dealing with aging complications, as probably approximately 90% of the aging population has at least one chronic illness. Approximately 75% have at least two chronic illnesses. So it may not be Alzheimer's and dementia or cognitive impairment, which is my specialty area, but it may just simply be living in America and aging in America. And so I help families navigate the long-term care system, connect them to resources, and really to build a support network and wraparound services around the family who's caring for an aging loved one living with Alzheimer's and dementia. Because I know you and your folks know all too well, it's not just the person living with Alzheimer's or dementia, it is the family, and in some cases, it is the community.
Yeah, no, 100%. If we are fortunate enough, we will be able to live a long life, right? We really work on being able to be grandparents, maybe one day be great grandparents. But we, especially as women, I think that far down the line, right? I'm already pre-planning, like, where do I want to live? What's my life going to be like? And I can't imagine being at a place where I forgot or what type of life I want to live, right?
Yeah.
I was put in a position to be the primary caregiver for my grandfathers. My grandfather was a Vietnam veteran and was having extreme blood loss, went into the hospital, and basically never came back out. He definitely never came back out the same. He was diagnosed with lung cancer and stomach cancer, and essentially was kind of prescribed you're going to go home and you could have better times, but over this next few months, you're going to pass away. And this was before hospice was officially introduced. And so having to become a caregiver, number one, meant that I needed to reprioritize my life. It meant that I needed to take my normal schedule and say, this is no longer my normal schedule, and be okay with it. Which may sound really easy for people, but it's actually a huge hiccup when it's not just like you, it's you, your husband, and your children, and you're trying to navigate that. My grandmother my grandfather has always been the primary decision maker. He's been the driver. My grandmother, who's almost 90, never got a driver's license. So he is literally the person that she depended on for everything. He was in his late 80s, and here she is almost 90, and they got married very early in life. And so I think that was the number one hard part. The number two part was having to learn. Like I had to lean in to learn, and this was, right at I would say like where AI was just being introduced as a go-to. Before, if you weren't asking your doctor, you weren't asking a friend, you weren't asking a Facebook group, what were you doing? You were going to Google it, right? And so this was really before I was being able to chat with AI to say, okay, this is what the doctor just said. But what I did know is I recorded every single time the doctor walked in the room, record on my phone. Like because
Yeah.
I may not know the answer, and you're about to say a word I can't even pronounce, and I need to be able to go ask someone else, like, what is this? So that I can help him make these decisions, right? Because the doctor's coming in saying, like, do you want to go through this additional test? Do you want to put this strain on your body? You're in your late 80s and your health is obviously declining. Do you want to do these things? Someone other than him has to be there to say, yeah, Papa, I think this is a great choice. Kudos to you. I know what it's like. Fortunately, I've only had to do that once in life. I'm sure I'll have to do it again, if we're fortunate, right, and afforded that
Yeah.
opportunity. How do you introduce yourself to families and even help people understand that they may be having some mental decline without actually even understanding that that's what's happening to them?
Yeah, you said so much in your statement. You really attested to a lot of times when I talk about family caregiving can happen overnight. I say that we're all an accident, an injury, or an illness away from either being a caregiver or needing a caregiver. And so when you said that you had to reprioritize your life, I mean, that is absolutely true. And that is absolutely very, very difficult to do. Approximately 20% of our population is in the sandwich generation population.
Mm.
That means you're caring for your own family and you're caring for an older adult loved one and you're working, you're trying to make a living and you're trying to be meaningful and purposeful in this life, and you're smack dab in the middle. You also talked about small families. I often talk about how our families are a lot smaller than our parents or our grandparents or great grandparents. You're not seeing 10, 15, and 20 kids anymore. You might find one, and then in some cases some people aren't having children at all. So we also have a situation, or really a growing epidemic of solo agers. So they didn't have any children, they never got married, they have no siblings. So what happens? Not if they need care, but when they need care. And so when you talk about becoming a caregiver overnight, the very first thing that you have to do at this point is identify as a caregiver. There are so many caregivers who don't even identify as a caregiver. In your case, oh, I'm just the granddaughter. I just make sure he understands what the doctor is saying. I just make sure my grandma has a ride to get to wherever she needs to go because my grandpa is going through chemo. You are a caregiver, and with caregiving comes responsibilities. And so you have to have a network, a peer network of individuals who are currently going through what you're going through or who have been through what you're getting ready to go through, because you're gonna need support. You can't do it by yourself. Some women, because we're natural nurturers, we care for us, them, and everybody else's, but we may suffer from the superwoman syndrome. Tiffany, you know that person that does it all, complains about doing it all, but won't let nobody else do it. Am I talking about you?
No, no, because I ain't gonna complain about it. I take it with pride. Like I love it.
Yeah. So what we know is approximately in the specialty area that I'm in, Alzheimer's, dementia, and cognitive impairment, approximately 35% of family caregivers actually pass away before the actual person that they're providing care for. And that is with any chronic
That's
illness.
crazy.
It is, and it actually used to be a lot higher than that. It is getting better the more we have natural, normalized conversations about you can't do it by yourself, nor do we expect you to do it by yourself, but also really to arm families and caregivers with tools of resources that can help them provide care for their loved one. And I'll say this. Oftentimes people will say to me too, I'm afraid that I'm gonna get Alzheimer's or dementia like my mom or my grandma or my spouse, because I heard, I guess the streets be talking, and the streets say, if I care for someone with Alzheimer's or dementia, I'm gonna get it. Well, it just doesn't happen that way. Like it doesn't. But what's happening is in the conversation that's kind of really dissected and compartmentalized is that when you're caring for someone with a chronic illness and you're giving everything to them, you have nothing left for yourself. You have nothing left for the important pieces of your world and of your life. And so you're depleted because you didn't prioritize and you did not, set boundaries, and you did not have a calendar that included yourself in regards to self-care. It doesn't sound like you did that. It sounds like, Tiffany, when you said you reprioritize, you just said, now here we go. Let's start
No, I
over.
did, but listen, no, you are so right. But my parents went through many bad years. They were addicted to drugs. Like it was all, my grandparents were always like my grandparents and my parents. And I was adopted. Like we were just so close. Like it was like they were my parents, but they were also my grandparents.
Yeah.
My grandfather, who I just shared, was that decision maker for all things for my grandmother, was also for me. So I really wore this vest with pride. I knew he couldn't depend on my parents. I knew, like, not in the same way he could depend on me. He
Sure.
couldn't depend on his wife, not in the same way. So I took this on, like, to know how I changed at this time. One thing that I would advise to anybody who's watching or listening that I did that is the best decision I ever made. Number one was have my grandparents sing happy birthday to me and both my kids independently, so I could always play this sound on our birthdays. And I wanted to make sure, because I knew he had cancer, but I thought we were going to win, right? And so at this time I was like, just in case this was going to happen. Also, I had our team go record videos. I have videos of well wishes on his first day of kindergarten, well wishes on his marriage day, well wishes for their oldest grandson on his wedding day, well wishes for him going to college. And it's so crazy that Papa like spoke what David is going through, like it's him in football. Like my son had never played football a day in his life. Papa only ever knew him as a soccer player, but to be able to speak on he never saw a football game. The first game my son ever played football in high school, my grandfather was in the hospital. So he never saw him play football. And to hear him like all-American football kicker and hear Papa's like stay on the right track, do this, do this, do this, like it's the best gift. So if you're listening or watching, the number one thing you need to do right now is pull out your camera, record, because that is what's going to get you through the ebbs and flows, the ups and downs. I can still feel like he's here when I hear him singing Patti LaBelle to my son on the couch, a whole song. I feel like he's singing to me right now, and it is the best gift.
Yeah, and it's almost like, put me in, coach. Like when I get the opportunity to get in, because I played basketball, I wasn't that good. It was because I was tall. But you know how you like you ready to get in the game and you like sit on your son would know you sit on the edge of the bench so the coach could see you. And when the coach puts you in, you just show out. It was almost like you were waiting because your grandpa was the patriarch of the family. He took care of everything. So you had already made up in your mind, whether you said it out loud or not, if they ever need anything, I'm gonna be right there, cape and all. And you were ready, cape and all. And I think what happens is there are people who fight against it. And it's nothing wrong with that. I have people tell me all the time, Dr. Macie, they would hesitate. And I know around and about what they're getting ready to say. I don't know if I should say this. I don't know if I can say that. I don't know if I need to say this, but I don't want to be his caregiver. I want to be his wife. Talking to families and caregivers in my practice, I talk to them about, okay, I know you don't want to do this, right? Who else can do it? Well, they can't identify anyone else to do it because they're the ones, and they don't trust anybody else to do it. And then as we're talking through things, and they're saying they've given me so much, I want to make sure that they have XYZ. Okay, well, now we're starting, right? Now we're getting somewhere. Now let's make sure this happens. So let's develop a plan of care. So I'm going to develop a plan of care around the needs of the family. I'm going to wrap supports around that caregiver. When I wrap supports around that caregiver, I'm wrapping supports around that senior who needs care. So I always tell caregivers, you can't do it by yourself, nor do we expect you to. But that's the thing, Tiffany. Family caregivers need and want to be heard, seen, and supported. And for those of you who are watching today, my mouth is very loud. I am from South Carolina. I make sure you are seen, heard, and supported. Not only family caregivers, but also paid caregivers, the ones who are the aides in the assisted living facilities and the nursing homes, the aides that come into your home to care for your loved one when you have to go to work and take self-care days. I make sure that they're elevated as well, because I always say caregiving doesn't work unless we do, unless caregivers
Mm,
do. And somebody
mm.
has to come in and support our loved ones. So we got to be sure that they're well supported, because we're leaving one of our most prized possessions with literally a stranger. So why wouldn't you? And a lot of times people just don't know that supports are there. So I make it my business to ensure that supports are presented in a way that's palatable, that's relatable, that's understandable, and that's accessible. And that's what y'all do on your platform with Now Included. So I'm just so excited to be a part of it. It's a platform by us, for us. And when you said earlier, you record it because that doctor gonna come in there and using them big words, and if it's a neurologist, he gonna come in and use the big words and walk right back out, right? And you're like, wait, what? Right? And so you want to be sure that there's a gap filler there, and I look at Now Included and Acclinate as a gap filler from one end to the next, from tangible resources and education to research.
No, I appreciate that call out. I remember in the earliest of days sitting down and saying, well, number one, I'm not a know-it-all. Number two, I learned to always be a life learner. And
Oh,
so that's just the
for
way I grew
sure.
up, right? And so I guess like even starting the platform in the earliest of days, it was very much like, I don't know what I don't know. So let's have the information available, but then let's make it make sense. Like, how would I find this? And the reality is, because I may not physically be with you, I can hear you and I can see you and I could connect to your story and what you're telling me more than a written blog article, right? Or
Sure.
more than advice from WebMD. And so the reality is, like, we started to see this morphing of social media, everyone adopting social media. I mean, this was even like, think about MySpace back in the day.
Oh
Like,
yeah.
it was really about that connectivity. I mean, what did it start as, a dating app? Like, it really was really truly just trying to get people connected. So Now Included was really like, let's create a safe place for people to ask the dumb questions, right? Because no
Mhm.
question is a dumb question unless it goes unasked. And let's have an environment where we know that one person at a time, one family at a time, these decisions are really happening. So it was funny because, I mean, Papa left his stamp all over Now Included from the very beginning. In my very first picture, when I was literally pitching the idea to my business partner, and he was a medic back in the day. And so he was like, well, one reality, Tiffany, is like, our healthcare system is a sick care system. People are going to the doctor when they are sick and we're waiting too late. So how could you, through the platform, and this was right at the height of COVID, how could you introduce conversations that are intergenerational? Sorry. This podcast is brought to you by Acclinate's Now Included community.
Get trusted resources backed by medical pros for your health. Tap into real experiences from people who look like you and find a safe place for your story. Walk into a space where being you is celebrated and find your power. Your health, your story, your power.
Allowing someone to have that grace to humble themselves, to feel comfortable with you, Dr. Macie, is so important. Like, it's so important for someone to just see you as a woman from South Carolina who's doing her thing, but really trying to lean in and understanding, like, oh, she's actually just here to help me. So how do you transform a relationship from, I'm just here to help you all, to providing those resources, to now, let me help you help yourself by focusing on self-care? How do you get people to think about self-care as something that's not a luxury, but something that's a
Yeah.
requirement as they're going through this journey and caring for their family members?
Yeah, I often say that self-care is not selfish, it is survival. So I am very intentional with accepting cases and with working with people and responding to comments and posts and DMs, because I'm gonna respond. Like when my family, so my grandma developed dementia, and this was probably after I had been in the industry for about 5 or 6 years. Like, I had no idea. I didn't know, but God knew that I was gonna need this information and education. And I was in the industry, and when my grandma developed dementia, I was dumbfounded. Like it felt just like a lump in my throat. I remember the day that I realized that this is it. Like I was sitting at my desk at my first real job, because I had a lot of little play jobs. My first real job, I had my sign on the door. I was real proud of my little job.
Oh, it was official. It was
Yeah, it was
official.
official. I made it official. And my sister called and she said that our aunt called her and said that grandmama is my grandma was staying with my aunt. My grandmama started going to different neighbors' houses, knocking on the door, crying, upset, saying that she was lost and she wants to go home. And it was in my mind, I knew it, but my mouth wasn't ready to accept it. And so I've experienced it, right? So I have professional experience foremost, because I was in the industry as a professional, and then personally. And sometimes it's very difficult to navigate the two. And so even though I tell families, because I was guilty of not being the granddaughter, I was guilty of being the professional. So I tell family caregivers, don't forget about your role. Don't forget about your God-given role. Don't be so much of the nurse that you forget to be the daughter or the
Mm.
granddaughter. Don't be so much of the doctor that you forget to be the spouse, the husband. You got what I'm saying? Because they still need that level of support. You're providing care, you love them, but at the same time, you need to feel one in that space. So I really had to work on that with myself to be the granddaughter, but then also shift. So I had to be very, very fluid and be able to shift when I needed to. And so I think that's where the trust comes from. Because when I say it plainly. I don't, what's the saying? I give it to you straight, no chaser. You ain't got time for that. Like you are a
Yeah.
caregiver. Like you are Kevin carrying 25/8. So I need to give it to you straight, which is why my books are not as large as some other books about Alzheimer's and dementia and caregiving, because I need to get right to the point. You don't need to know
Yeah.
where I grew up. You just need to know, how do I get mom to sleep longer? Because if she ain't
Yeah.
sleeping, I ain't sleeping. You got what I'm saying? And so I always tell people, I give them the stats. I always tell people too, we know the numbers, but I know the names, right? When you say 35% of caregivers don't make it, I'm talking about you, Tiffany. If you don't put yourself first, if you can barely stand up, how are you going to help your loved one get from one place to the next? You physically can't do it, right? And then mentally, are you mentally fed? Are you socially fed? We're emotional beings. Caregiving is a very isolating role. We think about, friends are not asking you to go out anymore because they know you got to take care of your mama. You don't, I don't know, like if you're single, you might not have dates or whatever because you got to take care of your dad. So people just start to make decisions for you and on your
For you.
behalf without even offering to say, hey, go and sit with their loved one while they go out and just take a walk in the sun. And I always tell caregivers, have your list ready. So when that person says, well, let me know if I can do something for you. As a matter of fact, can you bring us some dinner tonight? Like seriously, you can't do it by yourself, nor do we expect you to.
Yeah. You made so many good points. One of the things that I thought of as you were speaking, I've never actually said this out loud, but something were to happen to my husband, could I actually physically move him? Like, could
Mhm.
I really? And I know he if he heard this, he'd be like, "This is the craziest thing ever. You don't need to move me. Go call for help." But like literally, like I think like I don't want to. I never want to be in a position where I'm just sitting there looking at you.
Sure.
So worst case scenario, I'm dragging you, but I am strong enough to do something for you physically that we're not able to do at times if we're not physically fit, to the point you just made. So I hope someone feels hears this and hears, okay, so there's some glimpse, there's something you've shared or I've shared that is that spark for them to realize like it is on us to plan. Shame on you to get to the end of the day and not plan. I talk to my kids, what do I want my funeral to be like? Do I want to be cremated? And what do I want those final days to be? All I know is I've cared my whole life about y'all, and y'all better not send me to the wolves.
Yeah,
So
make sure it's written down. Let me tell you,
thank
planning
you.
bring, make sure it's written down. Planning brings peace. I am a planner.
Mm.
I only have one child, but they call her a time baby. Like everything was time to the T. I am a planner. And because I'm so much of a planner, when I don't feel like planning, Tiffany, because I want to watch like brainless TV, like I love reality shows. I love the Housewives franchise, and I watch brainless TV so I don't have to think about nothing. Sometimes I don't want to plan. Like, and when I don't plan, it's just like, oh, it's the end of the world. Like, give me a break. That's why women and caregivers have to set boundaries to say, hey, this is me time. I ain't thinking right now. Like, I'm not thinking, I'm not planning, I'm not prioritizing. That's called mindfulness. Like, I am going to focus on this bird that I'm
Oh.
watching. Like, it gives me so much peace. Women, and I want to say this too before I forget, you are a natural carer, right? I feel like you will be what we call a habitual carer. That's not a bad thing. That's that's where if something happens with any of your family members, your loved ones or friends, you're going to be the one to step up because you're a natural carer. Where that becomes a problem is if people start to take advantage of that characteristic that you have. But I feel like because you are a planner and you prioritize things, you're probably not going to let that happen. But there are habitual carers and caregivers that give for everybody in the family. Like that person is expected to be the caregiver because they always step up and do it. But that's because that's who they are as a person. A lot of times they may feel like they have to give back for what the person has given to them. Like
Hmm.
that is a part of their spiritual journey. That's what they do. But you have to set boundaries to ensure people don't take advantage of that because they will. But again, planning brings peace. Shame on you if you don't plan. But the most important part of the advanced care planning process is having the conversation because you can write something down and you think it's good, but you gone. But and now that person is going to implement what you wrote, but because you didn't talk to your spouse or to your children, you didn't know that the person that you have decided to give everything to got a little issue and they ain't gonna take care of it. So you want to have the conversation with people that are important to you, people that you're gonna leave stuff to, people that have to make the decision. They need to know, and so the conversation really is first, and then is the documentation of that conversation, and then there's execution. So you really don't want to have one without the other. But if I had to choose one, I would probably say the conversation is most important in terms of the social aspect of it. But then when you get into the legal aspect of it, then you would want that documentation.
Okay, now there's one aspect you forgot, okay? And
Uh-oh.
how do people afford this care? How do people truly navigate that end of life stage? How do they afford your services? Are there programs available for them? Or is this all pre-planned and prepaid in their life? And so when something happens, it's already there?
So I will say there's a couple of things here. Um, long-term care insurance. So long-term care insurance, I didn't know anything about long-term care insurance till I was well into my 30s. Okay, well, it's too late then. Long-term care insurance does take care, depending on the policy you have. A lot of times it takes care of the long-term care services such as me, a geriatric care planner or manager. It'll take care of in-home care. It'll take care of assisted living, any other out-of-home placement care, depending on the policy you have. But we don't typically see those policies anymore. Now they're either unaffordable or unavailable. So
Yeah.
outside of that, I tell folks to connect with the area agency on aging. There's a local area agency on aging in every county. They offer respite vouchers to help pay for in-home care, someone to come in to stay with your loved one while you go on vacation or just have some me time. I also tell folks to invest in a certified elder attorney. A certified elder attorney helps with that advanced care planning. A certified elder attorney also helps with Medicaid planning. The reason I'm saying Medicaid planning is because in America, you have to go broke in order to be able to afford non-medical long-term care. Medicare does not cover non-medical care. That funding has to come out of pocket, out of the senior's pocket, or either out of the family member's pocket. Medicaid does pay for it, but you have to qualify for Medicaid, both level of care and financially. And so a certified elder attorney will help the person preserve assets, spend down, and be able to qualify for Medicaid in 5 years. So if you're listening to this podcast and you are in line to provide care for an older adult loved one at some way, shape, form, and they don't have the liquidity to pay for someone to come into the home or for out of home placement, go ahead and reach out to that certified elder attorney and ask them for a Medicaid planning package. So that way you would have planned, to your point, planning far out enough to whereas if and when your loved one does need that level of care, you're in position to be able to pay for it.
Wow, that was great information. I mean, we definitely need to make sure that we share that very broadly because I had no idea.
Yeah,
I'm
and
sitting
save
here
it.
like,
You know, Tiffany, just like you save for your child and your children's college funds, you need to go ahead and put a little something something aside for your long-term care. You know, you got your parents taken care of, but you're coming too. So you want to be sure that your children know how to access the funding to be able to provide support for you as well. Even with whole life insurance policies, you can get a long-term care rider, which is what we have, to help pay for non-medical long-term care. So there are, you know, different scenarios out there and different options out there. You just got to know what to ask for and where to look.
okay, well, note to self, Gemini, Claude, whatever's listening to me right now, remind me to reach out to my insurance company because I don't believe I have that rider. And that's very important. Yeah, I definitely want to make sure that I set my kids up for success. So I think the final topic here, the elephant in the room for a lot of people is, of course, we're right at this intersection where we're encouraging people to consider clinical research when it makes sense for them.
Mm-hmm.
And I think there's a misconception about what clinical trials are, that they're really scary, that I'm going to be a guinea pig. And even though we advocate and tell people all the time, like there are things like an IRB board that are in place nowadays to protect you, people are still just afraid, right? Like if you get a new diagnosis, you're at the doctor, why should I consider a clinical trial when there's an approved therapeutic on the market? Will you kind of unfold how you discuss clinical research with people that you care for?
So, you know, you got to address the hesitation as well. We know the history of Black people in research and the trauma that unfolded that still exists to this day. People still do not trust the medical system. There still is discriminatory practices in our healthcare system. So first, you know, we got to identify that, address that head on. And then we have to better educate our individuals on the different types of research. It doesn't mean that somebody is going to be prodding and poking in your brain or in your body or in your heart. I'm doing a research study now where there is a camera. Again, like you said, you go through IRB, you get the protections and what have you. You consent to it. Nobody's just going to do it. You have to consent to it. Where we have cameras in individuals' homes with early stages of a progressive type of dementia. Those cameras and those monitors are gathering information about the behavior. And I often tell folks too, they ask, you know, how can we help, especially when there's not a cure? How can we help when there's not a cure for Alzheimer's disease? Well, you can get involved in advocacy efforts, of course, but you can also get involved in research. After the loved one passes away, you can donate their brain to science, so that way they can get the researchers and can do the clinical trials to be able to determine what are some of the treatment options, but more importantly, how can we prevent this? What causes it? How can we prevent it? And that's how, you know, we were able to get cancer treatments, how cancer was able to go into remission, where we are with HIV and AIDS because of clinical trials and research. But we need people properly represented in these trials and in this research so that way we can ensure that the treatments and the medications that we are receiving is for us. I don't know if you all do anything with pharmacogenomics or not, but now there are statuses and structures, whereas if you do a blood test based on your genetics and your genes, a particular medication at a particular dose will be most effective for you. It's much more cost effective to be preventative than to be reactive.
No, I appreciate that. I mean, you've dropped so much advice for people. If you were going to leave listeners with one question they should ask their physician when at that next appointment if a loved one was just recently diagnosed? What would that question be?
The first question would be, what type of dementia does my loved one have? Because I mean, it's much more I won't say easier, but realistic for the doctor to say the person has dementia. The very first thing or the very next thing you want to ask the doctor is, what type of dementia is it? The reason that's important in this day is because we now have a treatment for early stages of Alzheimer's disease. If you're listening to this and you're seeing signs in your loved one or in yourself that you're concerned with forgetting, memory loss, not being able to perform familiar tasks, forgetting names of people that you see every day, I want you to get to your primary care physician and ask for a cognitive assessment. You want to have a neurologist on the team as well, so that way you can have your brain scans, your MRIs, to determine if there is any type of atrophy. So that way you can get a diagnosis as early as possible, so that way you can get the treatment. And I explain all this and break this all down in my book, The Complete Dementia Caregiver's Guide to Care.
I was going to ask about that. So you took me right there. I was going to say, and earlier you mentioned that book that wasn't too thick, wasn't too thin, but it was just right and took you straight to the advice. So tell us, how can people find the book?
The book is available as an audiobook, as a paperback hardcover, and a Kindle book. The Kindle and audiobook are on Amazon, but the paperback and the hardcover is available any and everywhere you get your fine books.
Okay, and if people are looking for your training center, how can they find that?
So they can head over to my website. It's www.drmaciesmith.com, and that's MACIESMITH. And I am on all social media platforms, including TikTok, but don't go over there just yet. I'm still working on that one. But I am on Facebook, Instagram, LinkedIn, and I have a robust YouTube channel where I have a lot of long-length videos and trainings that I have available for individuals when they come over, because we're all in this together. People need basic information, basic training, and actionable items, and that's what I give. I want the information to be actionable and effective and impactful that day. So that's what you'll find there.
No, I love it. It's no surprise to anyone that you are Now Included. This is Now Included Unfiltered, and don't worry, we saved you a seat. Thank you so much, Dr. Macie Smith.
Thank you.
Thank you for listening to Now Included Unfiltered. If you enjoyed this episode, be sure to give us a follow and leave a 5-star review. We'll see you next week.